if you've never done therapy before, or you can think back the first time you were connecting with a practitioner or a therapist, it is scary. Like, I'm in the field, and I remember the first time that I had got my own therapist, I was like really intimidated. And even though I am trying to break down the stigma and like I'm in the field, I'm such an advocate for mental health, obviously, it was really hard for me to reach out to a therapist. For some reason, it's still like uncomfortable, anxiety provoking. So I guess something that I want people to know is that, yeah, it's a big step to even just like send that first email or make that first connection. It is a scary thing, or it can be a scary thing for some people. You know, thinking about the things that you would talk about in therapy, that can be really scary to think about. And of course, there's still stigma, and it's not as normalized as it should be. So that's definitely part of it. You know, maybe family doesn't believe in mental health or mental health supports, or nobody in your friend circle is really supportive of or kind of talks about therapy. So I think it's also your environment and people around you and how supported you are in talking about that and engaging in that. There's definitely a lot of factors why it can be really scary, but I think, yeah, just taking that initial step, you know, the more we avoid, the more our anxiety is maintained. So if you can just, you know, send that first email or reach out to a few therapists or connect and talk about it a little bit more, it gets less scary. And I think the rewards are so much greater than the initial fears. So it is worth that initial risk. But definitely one thing I think that is really important is knowing that you're not going to match with every therapist, right? And just like any other healthcare practitioner or professional in any field, let's say, there are people that you're not going to like. There are people that aren't good at their jobs. There are people that you won't like their approach. The good thing with therapy is that there are a lot of options out there, and you can kind of shop around. You know, family doctors are really limited, for example. It might be very difficult to find a family doctor, but there are so many therapists out there that have availability. So I think actually shopping around and having the privilege to be able to meet with different therapists and actually decide, who do I connect the most with? That is really cool that you can do that. And you should do that, because the connection that you have with a therapist is the number one factor in successful therapy, right? So you have the right and the privilege to shop around, see who you match with. And if you don't match with someone, then, you know, meet with someone else. Or if after a while you're feeling like you need to switch things up, then you can do that. So it's pretty, in a sense, it's almost easier to switch therapists than it is like family doctors, for example. So I think I would tell people to lean towards practitioners or therapists that you feel connected with. And if you don't feel connected with them, then just, you know, find someone else or meet someone else. Do those free consults, do those free meet and greets, and really lean towards the person you connect with.